You don't care about the animals, and unfortunately you don't care about the health.
We have that information. They won't let them use the word because it might cause Americans to take action.
Neal Barnard has been a groundbreaking visionary. He is revolutionizing the way that we think about our health and how we take action concerning our health. And he has an amazing presentation in store for you. And it doesn't hurt that he kind of looks like Clark Kent. Because you know what? I think he's a superhero, and I bet you do as well. Please give it up for my friend Dr. Neal Barnard. Thanks, everybody. Thanks for coming. We doing okay so far? Yes! It's great to see some old friends and plenty of new friends, so thank you very much for coming. I got to tell you, I don't know if you're like me, but I was not raised on anything like a healthy diet at all. I grew up in Fargo, North Dakota. Anybody been there? Anybody seen the movie? Yeah, that's my mom in that movie. Anyway, when I was growing up, every day it was roast beef, baked potatoes, and corn. Except for special occasions when it was roast beef, baked potatoes, and peas. And that's all I knew. And I got to tell you, what got me starting to think in a different direction was the year before I went to medical school, I had a job at a hospital in Minneapolis, and my job was in the basement of the hospital in the ward. And when anybody died in the hospital, my job was to examine the body with the pathologist who was doing the autopsy. And one day a man died in the hospital of a massive heart attack. Probably from eating hospital food, but that's another story. And so we had to examine this diseased heart. And you don't do this with, I don't ever seen an autopsy, it's not done with great delicacy. You take what looks like a golden clipper, and you go, on this side, on this side, and you pull this wedge of ribs off the chest, stick it on the table, and that exposes the heart. And because the pathologist knew that I was going to go to medical school, he wanted to make sure I didn't miss anything. So he said, take a look. On the surface of the heart are the coronary arteries, and we call them coronary because they form the heart. And with this stone, he sliced open one of those coronary arteries. And he said, Neal, take a look at that. And so I took my gloved finger and I started poking around in this artery, and it was something. It was not just this wide open, flexible tube that could carry blood and oxygen. It was hard like concrete. And he said, that's your bacon and eggs meal. That's atherosclerosis. And you look at the carotid arteries. You know the carotid arteries, if you feel the pulse in your neck, that's the carotid going to the brain. This person had that same narrowing there too. And the arteries were low. And he said, you know, we see the beginnings of this disease in 3/4 of young men by about age 23, which is the age that I was at the time. So, anyway, so the pathologist writes up his findings: acute myocardial infarction, systemic atherosclerotic heart disease, and he leaves the room, goes away. So I'm with this body, and I cleaned everything up, and I took the ribs off the table and tried to make them fit with the other ribs in the chest, and I sewed up the skin and finished up. And then I went up to the cafeteria, where it turned out they were serving ribs for lunch. And I have to tell you that I didn't become a vegetarian on the spot, but somehow between the look of it and the smell of it, it seems to me like a dead body. And you know what? It is a dead body. So anyhow, then I started medical school, and we started to learn about the power of healthy eating. And that really was the first thing that struck me. A, it's powerful. And I want to talk about both of those. Regarding power, do you know the work of Dr. Dean Ornish? But he's a Harvard-trained physician, a real medical genius, and he not just can we prevent a heart attack, but when a person has those narrowed arteries, can we make it go away? He brought in people who had serious heart disease, and all we asked them to do, get the animals off the plate, go away the cigarettes, have a little bit of regular exercise, like a half-hour walk, nothing serious, and try to manage stress, which is why he didn't even study here in Washington, D.C. And anyway, a year later, everybody goes back in the hospital, they have an angiogram. Angiogram, that's an x-ray of the heart. It shows you the tiny trickle of blood that gets through the arteries. And he compared the results to the year before, and it turned out that the arteries, instead of getting narrower and narrower and narrower, time was going backwards. They were starting and enough that you could see a measurable difference in 82% of the patients in the first year. No drugs, no surgery, none of this roto-rooter to try to open up your arteries. It just was a healthy diet and a healthy lifestyle. Very simple. That made medical history. And now, when a patient has heart disease, and the doctor says, maybe this is the way we ought to go, Medicare jumps up and says, we'll pay for that, because it costs a lot to have heart surgery. How much does it cost to eat asparagus? It's a great idea. So he also showed that it wasn't just your heart that got better. The average person lost 22 pounds in the first year. Their blood pressure came down, everything improved. So I became very enthusiastic about this, and I started giving lectures around the country. Notice that some parts of the United States were more receptive than others. One day I was in Lubbock, Texas, and Lubbock, Texas has universities and scholarly people, so I was giving a lecture there, and I noticed that every time I would talk about the value of a vegetarian diet, there was a group of sort of 10-gallon hats in the back that were kind of grumbling and making noise and things, and I thought, well, you know, they need the message too. So I started to go on a little bit further to talk about how the same kind of diet could reduce the risk of stroke, it helps to lose weight, it's really good. The audience started just heckling me. But I gotta tell you, my own family grew up, I grew up in the Midwest, my grandpa was my dad grew up in the cattle business, so these are good people, they just need facts. So I laid it on pretty thick about how when you get the animal products out of your diet and encourage everybody you know to not eat animals at all, they're all going to be very healthy. And at this point, the audience started throwing things, and it's an animal agriculture school. Okay? They didn't want to hear my message. But I finally just said, look, you guys, you can heckle me as much as you want to. But this process of atherosclerosis, this hardening of the arteries that comes from a lifetime of eating meat and other animal products, it doesn't just cause heart attacks. It can also make you impotent. And I had their complete attention for the rest of my lecture. And I'm not making this up, okay? Write this down now. The male sex anatomy is a hydraulic system that requires good blood supply in order to function. Are you with me? Okay. It was obviously devised on a Monday because things are going wrong with it all the time. And in the same way that if you don't get good blood supply to your heart, you have a heart attack. And if you don't get blood supply to your brain, you have a stroke. If the man does not get good blood flow to his private parts, you have cable TV. So anyway, at the end of my lecture, I had all these 10-gallon hats lined up for my power brown rice recipes. And anyway, so in our own research, we have shown that this kind of diet is terrific for so many things. It's good for people with diabetes. Folks with diabetes come in and they start to realize that what we have been taught about a healthy diet. You know, people with diabetes, it's don't eat noodles, don't eat beans, don't eat this, don't eat that. See? Let's get the animal products out of our diet. Let's keep the oils low. It turns life in a whole different direction. I don't mean to say that it's a cure-all, but I mean to say it's more power than any other approach you've ever had. And some of the things are surprising. Researchers in Scandinavia started to look at back pain. Back pain. What could that possibly have to do with food? Watermelons are heavy? No, I don't know. Well, the first thing they discovered is that people with lower back pain tended to be smokers. How could that cause back pain? And then they did autopsy studies looking at the arteries to the back. And it turned out that smokers have very aggressive atherosclerosis and lost the arterial blood supply to some of the vertebrae. And the discs that were between the vertebrae started to degenerate and they got back pain. And then it became clear that first arteries to get blocked up. The very first arteries that you lose, the very first ones to get destroyed, are not the arteries in your heart. They are the arteries to the lower back. And what I'm suggesting is that we have wear and tear to all parts of our body. But if you're on a healthy vegan diet that gives you good blood flow and good oxygen supply, you can heal from that wear and tear more easily. So it's surprising the number of things that can get better. Okay, but then when you explain to the patient or to your family members, this would be a good way to go, they will say to you, I believe you. I'm sure I'd be healthier if I do this. But if I go on a vegan diet, I'm going to have to live in the garage. People are going to divorce me. Nobody talk to me. There's no way to eat da-da-da-da-da. You know what I mean? Well, we have a way of introducing this diet that I have never seen anyone unable to do it. We break it into 2 steps. And the first step is don't change your diet yet. If you're thinking, maybe I could try this, the first step is just check out the possibilities. What I mean is, think about a breakfast, or a lunch, or a dinner that happens to have no animal products. And think about them, write them down. If you want to try something new, like veggie pizza and you never had it, try it out. So all we're doing in the first week is trying out healthier options. By about 7 to 10 days, you got everything right. You know that you can have blueberry pancakes, or oatmeal with cinnamon and raisins, or almond milk on your cornflakes. You know that you got your breakfast. And you know that if you go to Subway, they're more than happy to give you a veggie sub with no cheese and no meat. You know if you go to Taco Bell, not the pinnacle of culinary art, but nonetheless, they'll make you a bean burrito. And you got the various choices, okay. And you can go to the fanciest Italian restaurant in town and they'll give you pasta fagioli, lentil soup, or minestrone, and angel hair pasta with artichoke hearts and wild oyster mushrooms and little tomato chunks, and it's okay. And then somebody points out that wine might be in the food group, whatever. Anyway, when you're ready, when you've got your list of things, then step 2 is to do a 3-week test run. You're not swearing off anything forever, just 21 days. At the end of that period of time, 2 things will have happened. The first is you're healthier. You're losing weight, your blood sugar is better, you're feeling your digestion is sorting itself out. But the second thing is that your tastes are starting to change in ways you didn't expect. And if you don't believe me, let me ask this group. How many of you ever whole milk to low-fat milk or skim milk? Let me see hands. Okay, I'm not saying that skim milk is healthy, but how many made that change at some point in your life? When you did, what was the skim milk like at first? Watery? How many of you eventually got used to the lower taste, lower fat taste? Okay. Did you ever go back and taste whole milk again? What was that like? Too thick. Okay. Your whole life it was perfect. But as soon as you get away from it, your taste buds physically change to prefer the lower fat taste. So when a person goes on a vegan diet, the first week it does seem too light. But, and you're going to take, I have to require a taste for folk music now. Okay. Break up the tie-dye guys, I'm vegan. Okay. But then, after a couple of weeks, it starts to make sense. And you discover that all your friends think you're cool. And this is what you discover books and recipes and new foods and all kinds of things. After 4 weeks, if you then went back and had a double bacon cheeseburger, you would discover I'm just finished. Your tastes have changed and you now are in a different place. So, first of all, just take a week, check out the possibilities, see what you like. When you're ready, do it 21 days. It's going to change your life. And at that point, you can decide what you want to do. Don't burden yourself with, I am never, ever, ever going to have another, whatever you fill in the blank. Just for right now, make it a plan. And be careful about moderation. Sometimes you can inch into something, but at some point, put a fence and the things that are causing you harm. We learned about this with smoking, but it's true. When I was an intern at the George University Hospital, I used to go into the hospital gift shop and buy Merit menthols. And I didn't feel so bad because my head of surgery was buying Marlboros. And anyway, we weren't idiots. We knew we had to quit, but we were taking our time doing it. And once we decided to quit smoking, we realized it is much, much easier to not do moderation. It's easier to just quit and put the cigarettes out and just decide I'm not going to have it. If you try to have it now and then, it brings you back. And I got to tell you, that's true of cheese also. Am I wrong? It smells like old socks, but it's calling your name. So just make sure it's out of the house and you don't hear it calling you. Because it's 70% fat, mostly saturated fat, high in sodium, high in cholesterol. If it were any worse, it would be Vaseline. It does not love you. So get those foods out of your life and you're going to do well. Okay, a few things that I just want to mention real quickly. Are some of you members of the Physicians Committee for Responsible Medicine? Thank you very much. If you're not, please come over with us right over there. And we'd love to have you as part of our organization, whether you're a physician or not. We welcome everybody, and there's a lot that we need to do together. For example, right now a kid goes into school, and his well-meaning parents say, I really wish there was something vegan there. But you know what? There isn't. And that child's going to have cow's milk on his tray, even if that child is lactose intolerant, and says, I'm going to spend the afternoon in the bathroom. I'm sorry, that's what we have here. That kid's going to have meat, and sometimes it's even the worst meats. It's the processed meats that we know clearly are linked not just to heart disease and to diabetes, but to things like colorectal cancer. And that's, in a school that wouldn't allow cigarettes within 500 yards, is feeding the foods that are going to cause cancer too. That's got to change. But you know what? If you were on Capitol Hill and you sit down with a member of Congress and say, can't we clean this up? The member of Congress will say, you're right. If kids ate in a healthier way, if we had vegetables and fruits and whole grains and beans and we threw out the meat, our kids would be healthier. By the time they get back to their office, there's a call from Omaha, or there may be a call from Atlanta about Coca-Cola, or that the lobbies way in. Members of Congress are afraid because they think they're going to get voted out of office. Well, here's what I'm going to say. There are big food industries out there. They've got a lot of money. But you know what? There are more concerned parents and more concerned doctors and more concerned nurses and more concerned people in life who want kids to be healthy. Our biggest problem is that we are quiet. We keep our mouths shut. We should be up and say, I'm voting for you, and I want. Doctors right now don't learn much about nutrition. There was a bill in Congress called the Enrich Act, as in enriching education, and members of Congress are right now deciding whether it's worth teaching doctors about food. I'm not making this up. They are waiting for your call. There is a bill in Congress called Education and Training for Health, Eat for Health. And it would make every federally employed physician, like at the VA hospital, have to have 6 hours of continuing education every year on nutrition. And here are members of Congress thinking, should they or shouldn't they? They're on the fence. They need to hear from you. A couple other things I just want to mention. We are offering free classes, and if you come to our group, we'll let you know about them. They're at our office on Tuesdays. We have diabetes class. On Wednesdays, diabetes class in Spanish. We have free yoga, and we're having a weight loss class, all for free. We'd love to have you there. Please tell your reluctant spouses about it too. And thank you. And the last thing I just wanted to mention is that we're starting a new clinic. And the reason that I'm doing that is it's going to be up on Wisconsin Avenue, and if you need a flu shot, we'll give you a flu shot. But what we're really doing is helping people, in addition to regular standard medical care, to take a good look at what helps them to change their diet in the best possible way. So we'll have doctors and dietitians. We're opening early in 2015, and if you let folks know about it, I'd really appreciate it, because right now, so doesn't know anything about nutrition, and doctors who live it. But if you're on a perfectly healthy diet, what we've decided to do is set up a clinic where medical students and residents can come through and train with us and then carry that message back to wherever they are. So, I hope that you find all this information useful. And I hope that the tastes and the books and things that you have been helpful too. But keep in mind that the people who need this message the most are not here. There are 12-year-old kids and 72-year-old grandparents who never really learned about the power of food for health, let alone the power of food to help the environment, to make the world a safer place for animals, to make the world better all in all. You're empowered, you've got the strength, let's make some noise, spread it around. Very much.
Thank you so much. He's so amazing. So amazing. Dr. Barnard will be signing copies of his book at the PCRM tent right up there shortly, so you go up and have